Welcome back, y'all. Kurt here with Dr. Jake, and we are back with another video in our Fusion series where we're fusing the science of exercise with forward-thinking medicine. This video is going to kick off a three-part mini-series where we're going to be looking at cardiac risk profiling. And from an exercise side, I'm pumped for this. I know that certainly cardiovascular disease is our enemy number one in the field. So being able to assess for that a little bit better is quite important. And Jake, I'd love to hear, just what you're doing on the clinic side that's a little bit different in terms of your panel and your profile.
Yeah, I think there are a few things that set the cardiac risk assessment that we're doing apart from kind of the more standard one you may get with the primary care doctor or maybe even a cardiologist. But the key thing, and the one that I want to talk about today, is a biomarker called apolipoprotein B.
All right, I've got the lipo, I've got the protein, but put it all together for me. Where's the ApoB coming in?
Yeah, so lipoproteins are particles made up of lipids or fats and proteins, and they just allow us to transport fat-soluble substances like cholesterol and triglycerides through the aqueous solution or the watery environment that is our bloodstream. And you've probably heard this word lipoprotein before, even if it initially seemed unfamiliar. LDL and HDL, those terms that we've all seen on our lipid profiles, stand for low density lipoprotein and high density lipoprotein.
So if I'm looking at the model right, we've got this yellow fat base, and then we have these proteins sort of embedded in the surface.
That's right. So these lipoproteins are a core of fatty molecules with proteins kind of wrapped or studded or embedded around them to improve their water solubility. And each one of these proteins serves a different function, and so over the years we've identified them, categorized them, named them, and ApoB in particular is a very useful biomarker because there is one and only one of these ApoB proteins on the surface of every particle in the LDL family.
So run me through a little lineage here of your LDL particles. What particles are within that family?
Yeah, so LDL particles don't come out of the liver as LDL. They initially start out as a particle called VLDL, or very low density lipoprotein. When this comes out of the liver, it's got cholesterol and triglycerides in its core. It's got its ApoB on the surface, and its job is to travel around the body and deliver those triglycerides and some of that cholesterol to different tissues and organs. As it does that, it slowly becomes slightly more dense until we then categorize it as an IDL, or an intermediate density lipoprotein. Now this gets rid of even more triglycerides and ultimately becomes an LDL, or a low density lipoprotein. At this point, there's really no triglyceride left. There's just a cholesterol core with that ApoB protein left on the surface.
So if I'm tracking with you right, each stage of the family here, or the lineage, is going to have an ApoB present.
That's right. This is a whole family tree, and really the defining factor in it is that it has an ApoB on its surface from birth to recycling by the liver, and there's always only one of those ApoBs on its surface.
So my next question is going to be, why does this matter? Why is the ability to count these ApoBs important?
So it's not only LDL particles that contribute to atherosclerosis. Every member of this ApoB-bearing family can contribute to cholesterol plaques in blood vessel walls. They're all what we call atherogenic. And so by only looking at LDLs, you can be missing out on other members of this family that can also be contributing to the problem. And for most people, for a lot of people, ApoB and LDL cholesterol are often what we call concordant, or that means they agree with each other. One's high, the other is high. But not an insignificant number of us, actually, they're discordant, meaning one can be high and the other one can be low. So it is possible to have a low LDL-C and a high ApoB. And for those folks, if they were only checking their LDL cholesterol levels on a standard lipid panel, they would be incorrectly underestimating their cardiac risk.
So this is really about people that are sort of falling through the cracks, maybe on just a traditional cholesterol panel.
That's right. It's all about building the most robust risk model that we can. And the data shows us that when these two markers don't agree with each other, that ApoB is the better risk predictor.
Awesome. Well, Jake, thank you for running us through that. We'll be back with our next video in the mini series, so stay tuned.